Now, government says 11 new outbreaks of foot and mouth disease have been confirmed. The total number of infections is now 127. There were 5 new outbreaks in KZN, 5 in the Free State and 1 in Gauteng. The Agriculture Department says the new cases were likely already on the farms when the standstill was initiated. It adds that the standstill is likely to show better results after 2 weeks. So far, 19,000 cattle have been vaccinated in Gauteng, more than 26,000 in Mpumalanga and around 2,500 in KwaZulu-Natal. The department says it will reconsider the ban on cattle movement at the end of the 2 weeks of standstill. It's also looking at lifting the ban on provinces that have no cases of foot and mouth in a week. We're now joined by Minister Didiza to speak further on this matter. Minister, good morning and thank you very much for your time. You had some sort of a status update. Can you just give us holistically what is the status insofar as the disease is concerned or outbreak?
Thank you very much, Mfundo, for giving us an opportunity to share with you, but also the viewers, about the status today. As you have given in your background to this interview, within the period where we put the standstill between the 18th and the 25th of August, only 11 cases have been picked up. And those cases are in the areas where we had already seen a nucleus of the disease, and that will be in the Free State, in KZN and Gauteng. So around the area where you already had an outbreak, that's where we've picked up 5 cases in the Free State, in the surrounding area, in Viljoenskroon and Marquard, and also in KZN, as you saw last week, that they were injecting around eThekwini district, KwaNyuswa, and 1 case in Gauteng. But in the other provinces, as we speak, we have not picked up any case, and it is for that reason that we will be announcing the lifting of the ban very soon on those provinces where we have not picked up anything.
So you're saying basically this is not a cause for concern for most, that it could go beyond what we're seeing now?
Precisely, because we have been doing surveillance, and our surveillance shows that in the other provinces there hasn't been any infection that has been introduced. You know, usually the incubation period of this disease is about 2 weeks. So when you count from the 18th to date, already 2 weeks has gone, which means, therefore, that if there was anything in those other provinces, you would have seen clinical symptoms already, or laboratory would have proven that in these areas you already have an infection. In these provinces, we already, even by the time when we went out to put a complete ban, there were already infections in those areas. And where we found these 11 cases is the surrounding farms around where there was the nucleus of the infection.
Have you been able to quantify perhaps the impact on red meat farmers that this particular ban has had?
Well, in terms of monetary value, one has not given any detail for now. I will be able to announce that probably tomorrow or Saturday when we do the lifting of the ban, to get an exact impact on the red meat producers. As you know, that though some of those farmers would still send their animals, particularly the feedlotters, to the slaughterhouses, the impact may not be as much. But for farmers who rely on auctions, there has been indeed tremendous impact, because they have to remain feeding those animals which were ready for sales.
And then beyond this, any further education around vaccination? Because, I mean, perhaps this could be prevented in future where we don't see a ban of this kind.
Well, we are continuing with the drive, to inform firstly the citizens about animal diseases in general, and more in particular the foot and mouth disease, which is endemic in some parts of our country. We've been engaging various provinces where they've got game parks, because as we know that the carriers of foot and mouth in large measure are the buffaloes. So we have had discussions with KZN, which included the Premier, our MEC for Agriculture, as well as the MEC for Economic Affairs, who is responsible for the management of game parks in the province. We've done the same with the Free State, where we had, again, a meeting with the Premier and the relevant MECs. We will do the same in the Northwest. We do so because we think it is important that even within government, there's a better appreciation that this is not just an agricultural problem, it is an economic problem, because the impact is not only felt by farmers, but also is felt by our economy in general when there cannot be any livestock sales or even export of meat to other countries which needed revenue. So it is important, but as I say, it's not only foot and mouth. We need to educate our people about rabies, which actually affect domestic animals such as dogs. We also need to inform our citizens about the importance of making sure that we do the vaccination of our animals in the times that we need to do so. We also need to do dipping services so that we are able to manage the animal health of our animals. So we will be continuing with the drive, with the campaign, not only for farmers, but also for the general citizenry.
Minister Didiza, thank you very much for your time. That's Minister of Agriculture, Land Reform and Rural Development, Ms. Thoko Didiza.